In the previous session, we introduced the early development of hospice services in Hong Kong, up until the palliative care became a specialty within Hong Kong's healthcare system. In this session, we will look at the developments and trends over the past decade. After 2000, some non-governmental organizations, NGOs, established hospice care centers as an alternative to public hospitals. The Hospital Authority, HA, also collaborated with community organizations in 2007, establishing 10 hospice daycare centers in public hospitals over several years. In 2010, the HA gradually extended palliative care services to patients with end-stage organ failure. In addition to direct services, the community has also organized public education activities. As early as 2006, some organizations or projects began providing public education to encourage the public to discuss life and death issue with an open attitude, such as the Empowerment Network for Adjustment to Bereavement and Loss in End of Life, ENABL, and the Society for Life and Death Education. In 2012, the HA also enhanced services provided by clinical psychologists and medical social workers for terminally ill patients and their families. New developments also took place between 2015 and 2016. Firstly, the HA gradually strengthening support for elderly with terminally ill in residential care homes by enhancing the Community Geriatric Assessment Teams, CGATs, fostering cross-departmental collaboration with palliative care teams, and collaborate with the residential care homes. The Social Welfare Department also provided additional resources to residential care home for elderly for delivering end-of-life care service. The Jockey Club Home for Hospice, run by the Society for the Promotion of Hospice Care, officially commenced service in 2016. During the same period, discussions on life-sustaining treatment for terminally ill patients became more frequent. The HA revised 2 related guidelines and also published educational materials on advanced care planning, ACP, and advanced directives, AD, to raise awareness among healthcare professionals, patients, and the public. International developments also had an impact on Hong Kong. According to Quality of Death Index 2015 published by the Economist Intelligence Unit, which analyzed palliative care in 80 countries and regions worldwide, Hong Kong ranked 38th, with relatively low community engagement, comparing with other countries and regions. This indirectly led to greater attention from community organizations to the care of terminally ill patients. An example is the Jockey Club End-of-Life Community Care Project, JCECC, launched in 2016. This 6-year project emphasizes cross-sector and medical social collaboration to implement palliative services in the community and residential care homes for elderly, providing holistic care for terminally ill patients, as well as professional training and public education. Services for terminally ill patients have been increasingly valued. The Palliative Care Service Strategy has been launched by the HA in 2017. Setting out the direction and development for adult and pediatric palliative care for the next 5 to 10 years, with shared care models and medical social collaboration being key components. It is noteworthy that in the Policy Address 2018, community support for terminally ill patients and advanced medical directives, AMDs, began to receive government attention. The government's concern was not only confined to policy statements. In 2019, the Food and Health Bureau launched a public consultation on legislative proposals regarding AMDs and end-of-life care for patients dying in place. The proposals included converting the existing common law provisions regarding AMDs into statute to enhance its legal validity. It was also suggested to remove legal barriers for emergency rescue personnel in executing AMDs, and to amend relevant ordinance so that the terminally ill patients residing in the residential care homes can opt to die in place. The public consultation report was released in July 2020, and the government indicated it would begin drafting the relevant legislation, aiming to submit it for deliberation in the next Legislative Council term. At the same time, the HA also mentioned in its strategic plan 2022-2027 that palliative care will be one of the key services to be strengthened, and advocated for more collaboration with community organizations to enhance community support for patients with chronic and terminal illnesses. With the efforts of the government and various organizations, Hong Kong's ranking increased from 38th out of 80 countries and regions in the Quality of Death Index 2015 to 9th out of 81 in 2022, entering the world's top 10 for the first time. The need for community palliative care in Hong Kong is rising, especially during the COVID-19 pandemic. Over the past 2 years, as various factors, such as concerns over hospitalization, have showed a greater desire of people to receive care at home. In response, the JCECC project has been extended for another 4 years, until 2025. We hope that, with the concerted efforts of all parties, palliative care services in Hong Kong will continue to improve.